Well, he's already espoused radical theories. Now he says he's ready to make a radical departure from existing standards. HHS Secretary Bobby Kennedy Jr. now changing the way vaccines are tested. His new proposal would require all new vaccines to undergo placebo testing, a procedure in which some people receive the vaccine and others receive an inert substance before results are compared. Joining me now, medical contributor and epidemiologist John Brownstein. So, John, how could this new testing impact vaccines overall, you think?
Well, Kira, I'm a little bit concerned here because this could significantly slow down the development and approval of critical vaccines. If we require a placebo where an existing vaccine exists, that could put people at risk, right? We want everyone who can get a vaccine to get protected to do so. But in a pandemic, adding a placebo could really cost lives. We updated the COVID vaccine every year, and we did immune comparisons, not placebo, and that allowed us to quickly make these vaccines available, and it would not cost lives. And so it's really essential that we have to balance rigorous science with public health urgency. Otherwise, we put the public at risk. And we know vaccines are the most scrutinized tools of medicine we have, so we really have to lead with science and not fear when it comes to the approval process of these vaccines.
Isn't placebo testing already done, though? I mean, how would this new requirement change the testing that's already in place?
Well, Kira, you're absolutely right. Placebo is the gold standard for brand new vaccines. How on earth could we have gotten those COVID vaccines approved if they didn't meet critical safety and efficacy benchmarks? So that is absolutely the gold standard. What we're talking about now is changing the process for existing vaccines. Think flu shots every year or COVID boosters. This is a time when we need to quickly add and adapt our vaccines to meet the circulating strains. The problem is if we create these placebo type trials, it could really slow things down. And so the public wouldn't have access to these updated vaccines in time. And also, of course, it puts people at risk. You don't want to give someone a placebo during flu season when they need that critical protection.
So this new vaccine development would also involve methods other than mRNA technology, right? So what impact could that have on the effectiveness of our vaccines?
Well, Kira, I think it's a good idea. We should be looking at a wide range of vaccine technologies. What we're talking about here is a universal vaccine technology, maybe focus on whole virus or protein, and that could offer a broader array of protection against viruses. So that's fantastic. But we have to be clear, mRNA vaccines are incredibly effective and safe, and they're really going to be one of the tools that are going to help us win the battle against infectious diseases. So it's not just about one platform or the other. It's about finding the right tool for the right pathogen and not being a one technology fits all approach. So exciting investments, but we really don't want to lose sight of the vaccines that are working in the population now.
Dr. John Brownstein, good to see you, John.